All right, so we are going to start right now. For those that have registered for the webinar, they're getting to see the slides. They're also going to get the slides a little later. Excuse me. A little later today after the event, because I know some of the people couldn't make it. And they asked me to get the recording later. They're at work or couldn't make it. So one of the things that we are going to cover today is the fact that I'm trying to tie up and make a connection between healing the gut and healing the hormones, and why it's important, and why is there a connection. Even we don't look at gut inflammation often as a problem that's connected to having hormone imbalancing. And I happen to pay a lot of attention to that, and I just finished my second book on connecting gut healing to hormone healing, and how one can help the other and heal, and how it really is not really possible to heal hormones well if your gut is in chronic inflammation. So at the very beginning, and again to Facebook Live, I want to apologize that you don't have the slides. If you are attending the webinar, you are able to see them, and if you on Facebook Live trying to get the slides, you could always contact me later, and I'll send the deck to you. So if you are having abdominal pain, gases, and you're having blood sugar instability, constant diarrhea, constipation, belching, indigestion, reflux, fatigue, even already skin problems that originated from gut inflammation or malabsorption, malnutrition, autoimmune conditions where you're not even sure what started first, whether it was the gut inflammation or autoimmune condition that triggered issues going on with your gut. Also hormone problems or PCOS, and you are just overwhelmed with symptoms, or you got to the point where you just getting used to having chronic problems because nothing can really help you. You went to this practitioner, you went to that doctor, you get one prescription, you get another prescription, things get better, things get worse. Sometimes you need more prescriptions. As a pharmacist, I know how that works. Usually prescription leads to another one to fix the problem that the original prescription often caused. Hi, hello everyone on Facebook. So happy you're joining us. So it's truly not an easy condition to handle, especially if it becomes chronic, or if you've already been diagnosed with chronic problems, chronic illnesses, like in case of my first book on my original diagnosis, colitis, and then they diagnosed me with Crohn's. It wasn't the first thing that really happened. That's something that none of the traditional practitioners are looking into still. I'm sure we're gonna get there one day. Right now, it's still not happening. So you're having these symptoms. If you're lucky, you get diagnosed properly, and you get your true diagnosis, and you could get the proper treatment. Often, treatment for chronic condition involves really, really serious, heavy-duty, potent medications. And again, if you're lucky, the medications work, and you're feeling much better. But really, what you could call luck is something I have a little problem with, because I know that in my case, when I was prescribed a medication, it was a very potent low-dose chemotherapy medication for my Crohn's. At that time, biologicals were not as popular, although I tried it later. But in the beginning, I was tried a 6-MP, very, very potent medicine, which in my lucky case did not get me 100%. So that's why I was still looking for more things and more things to help myself with. And that's why I was truly given my path to where I am, to be able to help people that have the same kind of issues. If it really helped me at that time and didn't cause all these side effects for me, I'm not sure if I would be here today sharing and helping others and following what I'm supposed to be doing. So having these symptoms is definitely no fun. I'm going to quickly talk about people that are typical clients that come in. 42-year-old female client with digestive issues. She realized that her symptoms were causing her to become a person she didn't recognize. And her words was a word that she was no longer the fun person that she used to be. She was yelling, she was screaming at the kids. Her stomach was always irritable. She tried different therapies. She's seen physicians. She's seen her OBGYN. She tried treatment. She tried medications. She was involved. She told her friends she was having an issue and asked for advice. And she was still not able to get to have regular bowel movements. She was alternating between diarrhea, constipation. She had abdominal pain, and she couldn't just lose her regular. She couldn't lose the crazy mood. She couldn't get to her going to the bathroom well. So all she asked for is to get her life back. She said, you know, I'm having this for way too long. It's enough. I've had enough. I want to feel better. Or another case where you could meet Judy, 44-year-old, overweight, fatigued, depressed, wants chocolates, wants sweets all the time. She feels that she already has the food dependency, meaning that she constantly craves some kind of same food over and over. If she doesn't have it, she feels sad. Compulsive overeating is another problem that is often associated with hormone problems. She was having already low sex drive. She was crying easily. The flashes started. She thought it was normal. She was 44 and it's probably menopause. She was concerned, but there was a lot of history in her case, and she was a mess when she came in. She said, everything's wrong with me. I just want to get my energy back. I've tried a lot of things. I want to get my energy back so I can spend quality time with my family. And that's one of the things that is definitely more. It's a bigger picture than symptoms, because the symptoms physically, unless it's pain, unless it's something like really that bothers you, all these in combinations can become things that change your life. For example, I have to share this, a little bragging. Last night I received an email for a client that I just finished working with, and she said, in the past 2 months you have changed my life. She couldn't continue going back to school. She was in college. She couldn't see her friends. She couldn't get out of the house because of how she was feeling. So it's not really even take care of my physical symptom, this one or that one, take care of my food dependency, take care of my chocolate craving. It's much more than that. And if you understand, and if you've been there, and if you're having chronic problem, you will definitely understand what I'm saying. And in my story, I have had my share of fun symptoms. I never had great gut health, if you think about it, but it did get worse after my second kid. They misdiagnosed me with ulcerative colitis. I then was diagnosed with Crohn's after having after my first one, colitis. After my second kid, I was diagnosed with Crohn's. I was in ICUs. I had a terrible year, at least a really bad year. And then with my husband's help, we started looking for other methods. We are We were investigating, and again, that was 2003. Internet wasn't full of things like things are right now, like a lot of groups, a lot of information. It could be a good thing, it could be a bad thing, because sometimes you get a lot of misinformation on the internet. So you have to be very careful of who you trust and what you seek. I've tried different methods. I've tried acupuncture, breathing techniques, and I went to see John of God in Brazil for spiritual healing. I have done a lot of different things just to find finally functional medicine. And I was getting better with nutritional changes and all these different things. Acupuncture was great, but I was still not 100% until I found functional medicine, where I thought it was something that I totally align with, because if you think about it, getting to the root cause of the problem is truly healing the person, because it has to start somewhere. If you address where it starts from, you could take care of one thing or more. It could be other symptoms or other conditions that root, like autoimmune people, for example, they could have 2 different autoimmune diagnoses, and it could all root to having a simple gluten sensitivity, let's say, or severe gluten intolerance. It could have been an original problem that constantly irritated the gut lining, caused leaky gut, caused a lot of inflammation, caused malabsorption, and things just started, and it shifted. It opened. Yes, those people were probably predisposed to autoimmune condition genetically, but it might not have happened if they didn't hit the trigger. And just to finish up the story about me, I've searched and researched, and I'm a constant learner. I've been doing my doctorate degree from 2015 to 2017, just so because I've been a pharmacist since '97. But the reason I went back to school to get my pharmacy degree was because I really wanted to understand more about each and every study, to get into little details of how studies are conducted, how information is put together, what is the science behind it, and if you could really tell between the fluff that's in a study, or if it's a really true thing that you could trust. So it's great to be scientific, but you also have to have an understanding that many studies can get to the outcome that they originally wanted to get to, if you kind of put together things in a way that will lead to that outcome. So you have to be able to look through and see from that. Let me see if I could take that. Yeah, great. Okay. So what's super important when people, my clients, get to my office, and how we get to the root causes? During the initial consultation, I often, if not always, as a first question, ask, when did your first symptoms start? I try to get to full history, and it's super important to figure out when originally things started happening. And it can lead us to extremely interesting things that the patient often doesn't realize that, oh my goodness, 20 years ago, I went for an exotic trip, and I thought it was like a stomach flu, and at that point it was some kind of major parasite that is still not healed, and it's a silent chronic inflammation that's causing this person to be in constant chronic state. So we figure out whether that's a recent thing or long-standing, and how does all of this impact your life? How do you handle it? How do you have the fatigue? Do you have symptoms, or do you still have plenty of energy to live and do things that you like to do? And right now, if you have a pen and a paper, I have a really quick gut health questionnaire, if you are up for it. I have a couple of questions, and you could write down where you are as far as gut health at this particular point. So the first question is, and for every yes you're going to answer, you're going to write yourself a point. The question is, do you take any of these at least a few times a month? And first one is laxatives. Second one is oral contraceptives, birth control. And then the next one is NSAIDs like ibuprofen, naproxen, Motrin, Aleve, Advil, aspirin. All these are non-steroidal anti-inflammatories. Next one on the list is PPI. PPI is proton pump inhibitors, or they're already sold over the counter. They're no longer prescription items. They're something like Prevacid, Prilosec, or Meprazole, which is a popular generic name. And the last one for this question would be, are you taking any of the acid-reducing medications like Zantac, Tagamet, Pepcid, generic names are ranitidine, cimetidine, and famotidine? All right, so I hope you wrote your points. And the next question is this. Do you take care of your oral health? How often do you get checkups at your regular dental dentist or biological dentist, whoever you choose to go to? And options are every 6 months. So for 1 point, if you're going to answer for B, you're going to count it as 1 point. For C and D, 2 points each. So for the first one, every 6 months, there is no point. Then every year, you would add a point. And C and D, the last two, every 2 years, and sometimes you would add 2 points for each answer. Do you experience any of the following? That's the next question. A, burping or belching, and again, 1 point for each yes. B, fullness, gasiness, flatulence. C, poor appetite. D, constipation. E, diarrhea. Pain in the ribs is F. G, pain in the right side. H, gassy after eating fiber-rich foods like broccoli and cabbage. And I, chronic colds and viruses. Next question, and that would be the last question for the quiz. Do you often experience or have? And for each yes, you'll write the 1 point. Difficulty digesting foods, white coating on the tongue, bad breath, body odor, pain in joints, chronic allergies, food intolerances, nasal congestion, dermatitis or eczema, and mood swings. So if you have more than 7 points in total, you have a lot to work with your gut health. Chances are you possibly could have leaky gut, you could possibly have some candida overgrowth, you could have some gut microbiome imbalance, you could have something that we called dysbiosis before, we still call it that. And need of probiotic is there, need of an investigation is there. Figuring things out with your gut is really important if you have 7 points or more. If you have 3 to 6 points, you could also benefit from gut balancing and healing. Obviously, nutritional approach is important. And if you have 0 to 3 points, you are doing a terrific job. You are doing, you're eating properly, you're doing everything right, and chances are you do not have the leaky gut, so you are absorbing your nutrients well. Supplements and things that do cool down gut inflammation, and there are plenty. I listed particularly this list here on a slide of the ones that have been investigated by traditional science more. The reason part of why they're listed, when I did my doctorate paper, I spent a lot of time investigating each and one, and all these have the science behind it. That's why I mention it here. Some of the really great supplements are still not that popular yet, or there's simply not enough studies, and it doesn't mean they don't work. There might not just be enough money to put it into the study, or simply it's more or less of a new product where there's just not enough information. So for natural medicines, I'm gonna name a list of things that is found to be working. And again, I'm not recommending this because everything should really be recommended on the individual level, because the testing is important. Knowing your case and every little details is super important to recommend anything. But generally, just if you want to have the list, this would be something to go by, because this has been studied well. Bromelain is used for digestion. It's often found in digestive and some digestive enzymes. Andrographis is used for immune system. It has a good data supporting. Fatty acids, alpha-linoleic, omega oils, fish oils, they're used for decreasing inflammation. Gamma-linoleic acid, GLA, is used for hormone balancing and decreasing inflammation. So if you do have both, you kind of killing two birds in one stone with one stone. Colostrum is great for balancing immune system because it helps you loading up the immunoglobulins back. It's really healing, except for those that have milk allergy. So again, everything should really be looked into each individual case. Bovine IgG, that's something that's really is terrific. If you're trying to decrease gut inflammation and you're trying to balance immune system, it's a go-to product. Rutin, it has antioxidant properties. It's a great product to use. Green tea has a lot of antioxidant effects. Wheatgrass is wonderful for detoxification. Not a lot of people can tolerate it. Some people have reactions. Those that are really toxic don't feel very well afterwards. So if you're one of those people that take wheatgrass shot and just feel sick right after, you might be a person that needs detoxification more than others. So just for that little piece of information for you to know. In Indian frankincense, that's boswellia. It is used for inflammation, gut inflammation. It's also an ingredient for supplements that use combinations for like migraine pain and inflammatory pain. Turmeric is excellent for inflammation. There's also phosphatidylcholine that it has an anti-inflammatory effect and calming effects for those that are affected by high cortisol, especially at night. That's really helpful and really calming for those that have trouble falling asleep. Nutrition, how does it help? How does it work? And what are the keys for using healing nutrition? That's one of the things that I found in my practice to be the most interesting ones, because originally I didn't get training in nutrition. Pharmacy school, especially the first time around when I took it, had nothing to do with medications. You still probably, if you have been seeing doctors, physicians, that if you're having chronic digestive issues, your doctor probably says that, it doesn't matter what you're eating. A lot of them still are saying that. It does matter what you're eating, because that will determine success or failure of the end result. It depends where you want to go. That's something that you need to make it super clear for yourself. If you're one of those people that give me a medicine or even supplement because you think medicine is too chemical, too many side effects, let me go and work with supplements. You got to realize that without decreasing the inflammation with foods, you can't expect the full benefit of a supplement or medicine to give you the result that you're really looking for. So you got to do your part, and you got to go with anti-inflammatory diet, anti-inflammatory nutrition. I work with my clients on an individual basis. There are certain things that are general rules, but I still love to give pointers and to coach each and every client, because each and every person has a different taste and different things they're used to I believe that this should be very individualized. But again, generally you want to have whole foods, you want to have less grain if you're very inflamed, you want to have less sugar. I just didn't say anything new right now, right? Hello, who doesn't say that? But there are tricks with everything that I just said. What does that mean? Low sugar. Fruits and berries are both whole foods. They're great. Yes, but if you're having candida overgrowth, if you're very dysbiotic, fruits, high sugar fruits are not for you either. You could load up on berries, but you should not go with your fruits as your whole food that's super healthy. You should rather go for cruciferous vegetables that will be detoxifying, and that should be your source of carbohydrate. Combining foods properly is important. Not to, if you're, for example, like, again, green juices, for example, it's a super healthy, nutritionally dense food. You got a whole bunch of fruit, you've got a whole bunch of greens. There's a lot of vitamins, a lot of nutrition. You made it into a juice, probably green apple in there and some other sweeteners are in their fruits, for example. And you've had that green juice, and all of a sudden you have that high rise of blood sugar, and then a really sudden drop very quickly because all you had was that green juice. There was no fat, there was no protein, and as fast as it went up, that's as fast as it went down. And you are all of a sudden not feeling wonderful because your cortisol was just up and down, and you might be feeling heart palpitations, and you're thinking, oh my God, you're sicker than you really are. All it was is just your blood sugar was unstable. And you can't handle because your adrenal health is not at the point where you want to be. Generally, again, like I said, I love individual-based recommendations, but generally with foods to avoid, you have a general list of things like gluten, things like dairy. You want to avoid non-organic soy, GMO corn, fish that's been filled with mercury, like larger fatty fish that are not ideal. Conventional poultry, it's full of antibiotics. And sugar, of course, in packaged foods. You know, last year they finally made all these meats that have been processed, like sausages and bologna and salami, finally cancerogenic foods. And on our government level, we've been warned. I'm just curious, the sales haven't dropped. People are still having those kielbasas and sausages and salami just like before, those that have had them before. Just like it was with cigarettes decades ago, right? They did put the warnings on there. The cigarette sales did not go down until some serious restrictions happened. Like it wasn't allowed in public places. It wasn't allowed in restaurants, and so, like, I remember people were still smoking in movie theaters at one point. So we're probably gonna get there with kielbasas and sausages one day, when they just gonna literally stop letting them being sold. We're getting there, right? Decreasing inflammation with functional medicine. That is my favorite part. That's where I think it's like the most brilliant way of taking care of a person's health. We have this really great program that's broken down to 3 pillars, where we going after adrenal health first, which is basically neuroendocrine, because it's not just adrenal, it's adrenal and gut, it's HPA axis. We have our thyroid involved, we have the whole neuroendocrine system. And that's the ground, that's the basis of inflammation. If you are able to address inflammation already at that point and balance adrenal hormones, you could definitely take the next step and heal the gut much easier, faster. Everything you're going to be doing is just going to be working that much better because you addressed inflammation already. And the great example, just from my practice, I have with my H. pylori clients, for example, and I'm going to have a case in a couple of minutes I'll share with you. I remember working in a pharmacy and dispensing H. pylori medications, and often clients and patients would come back with more prescription and more prescription for H. pylori, obviously without being, that infection was not addressed properly with antibiotics and whatever the recommendations were at that time. The medications just often did not kill the bacteria. And that's where I'm trying to tie up with the fact that it was all treated separately. Like gastroenterologists did not communicate with other doctors, did not communicate with, did not get involved in the whole history of a client to figure out maybe there's a different root cause. So adrenal health obviously wasn't addressed, and therefore the H. pylori wasn't healed with antibiotics. And antibiotics are pretty potent. Using antibiotic destroys your gut flora for a long time. So that's something to consider. Not that I'm saying that you shouldn't. I require my clients to see doctors besides what we're doing, and for the doctor to oversee the process. It's a must. But I do want an involvement of that process, and I would really make a difference if you truly understand how the healing process works. So if you address the adrenal health and you were giving, even if you didn't go with me but went with your traditional doctor and did the H. pylori treatment with the antibiotic, you probably, I've seen case after case, you're definitely going to get a better result. That treatment will now work for you versus it wouldn't. And also super important, third pillar that I'm mentioning is the process of detoxification. So if you're not going to the bathroom enough, if you are if your liver, for example, if you have MTHFR, faulty genetics, and you're not supporting with the active Bs and folate, if you're having other genetic predisposition for detoxification problems, if there is just a physical detoxification issue, for example, you have bile stones that are clogging up your liver and you can't flush out of your system. So all these things prevent your body from properly flushing out toxins. So we've done the work, we addressed your adrenals, inflammation, we addressed your gut bacteria, or candida, or dysbiosis, or now that over parasite. All this has been done, you're feeling much better, but if the detox at that point is still not 100%, you could not get to 100% better. You're like 25% better after adrenals, let's say, 50% to 75% better after we address your gut, and you are not getting to 100% if you are not doing the detox part correctly. So that's why I say all three pillars have to be addressed. Although I do have clients that have been just totally happy after the first two steps. They said, oh my God, I'm feeling tremendously better. I don't need anything else. Hello, goodbye. And with the stool testing, I like particular lab company. It's a PCR technology. You could get key findings from this stool test. You could find parasites, bacteria, autoimmune triggers, gluten markers, gut inflammation markers, SIG-IgA, which is immune system marker for candida overgrowth, enzymatic activity markers, fat malabsorption marker, and other really, really useful markers to get to the root cause of the problem, something that's still being often overlooked. So you really want to make sure that these are addressed. There are other testing for the purposes of detoxification or balancing that we often use if we have to. That's organic acid test, very important. Even Even stool test might not be enough sometimes for a chronic gut patient, just for the purposes, for example, of finding candida, doesn't always find it. So O testing is necessary at that point, because the stool test will look into your large intestine. It's not really that simple to test your small intestine unless you're doing SIBO breath test, which is cumbersome to use, but the oat can show a full picture of your gut health. Neurotransmitter testing is important for those especially that have moods issues. Like if you've been having chronic gut inflammation, you could be making less of serotonin. Serotonin is the happy hormone. And throughout having that serotonin being low, you often could have depression or depressive symptoms, and just fixing your gut can start replenishing that hormone, and you could start feeling better and less sad and happier and no depressive symptoms just by healing the gut. It's just tremendous. Metal testing is important with urine or hair. SIBO testing, like I mentioned, it's cumbersome, but sometimes it's necessary. Food sensitivities testing is important, but I usually leave it as a last resort, because if there is a case of true leaky gut, most of the foods will show up as food intolerances, and we can't really heal a person by not giving any foods. You need food to have a diverse gut microbiome, so that's like a catch-22, and at that point you have to figure out the priorities, and that's where I come in. When it's a really difficult equation to solve, that's where I'm super useful. So a quick case, that was just a recent lab, and I happen to love this person and this case. A 54-year-old female complains of chronic diarrhea alternating with constipation, indigestion, fatigue, cramps, brain fog. Her symptoms were chronic. She was feeling that it was becoming her new normal, and recommendation was traditional, what we always recommend: adrenal functional testing, neurotransmitter testing, and of course gut testing for her. She was at 75% symptom improvement by 8-week mark. All symptoms were gone, completely gone at 6 months. And now I'm going to show you her results in February 2018 and February 2019. So if you see, she had a cryptosporidium infection, which is a pretty bad parasitic pathogen you really don't want to have. And that's one of those things that you could pick up on your trips to on vacations, or you could even get it here, but more chances that you pick this up on exotic vacations. She had a really nice H. pylori infection that was causing classic symptoms: heartburn and really uncomfortable burping. She also had candida overgrowth, which is difficult to treat unless all the bugs have been treated already. And this is her retest. This is still her February 2018. So this is very important to see. Look at her calprotectin level, 1170, over 1,000 on calprotectin. That is a marker of gut inflammation. And take a look at 2019 for her. She is retesting at no H. pylori, so herbal treatment that we use, botanicals worked really, really well because the adrenals have been addressed before and with the treatment. And look at her elastase. That I'm going to go back to her. I'm going to go back to her original test for a second again, because it's very important to understand about this marker. So see it in February 2018, her elastase was at 356. It's a really low number for enzyme activity, and that is because the acid suppression was happening because of H. pylori. And you're gonna go to see her numbers right now. it went up to all the way over 500. So that's a tremendous progress. That's tremendous. That's someone that's able to digest foods so much better. And by digesting foods, you actually absorb the nutrition better. So more nutrients are coming in and replenishing your system. And look at her zonulin. That's, I think, the number. Like, I don't have to tell you how much in love I am with functional medicine. You could just see a year difference of this calprotectin being at 122. She was over 1,000. I mean, it speaks for itself, the number. That's tremendous. So I just want you to, like, we have a few more minutes, and I want you to understand that supplementing by yourself can get a little tricky, because I am a big supporter of professional supplements, not for the point that that those are the ones that I particularly recommend, but because they're being studied, they're being tested, they are quality products. Super cheap vitamins are in some drugstores are simply dangerous, like vitamin C, for example. If you still see that the ingredients of a multivitamin formula has ascorbic acid, it's not a pure form of vitamin C. So you have to be careful. Or you see iron-enriched supplement. That's also something you don't want to do. That will mess up with oxidation and cause free radicals. You want to be careful with that. Some synthetic forms have xenoestrogens that are very harmful and imbalancing for hormones. Glandulars. There's a lot of talk now about adrenal supplementation and thyroid, even glandulars. For those that have thyroid problems, you have to get it from a clean source. So you have to know your brand. You have to find out what they're testing and how they're testing, because glandulars are often extracted from animals. That's how you get the glandulars. And you have to make sure those the animals that were not treated with hormones and antibiotics, because that's what you're now going to get in your product. Quantum butane is often now used by many people for heart, or if they're taking a prescription cholesterol medicine, which hopefully your doctor told you to use quantum butane. It's a really, really good thing to supplement, because statins will deplete you of that particular nutrient. But do get an expensive, good brand for quantum butane. Otherwise, if it's oxidized and it's not natural in a synthetic form, it could do more harm than good. And vitamin D. Vitamin D is very, very important to be used in a natural form, because it could actually be extracted from sheep's wool, original. If it's synthetic, you don't want to use that type of vitamin D. So choosing your supplements and being careful and educated when you make that decision is important. Going with the brand, like I love a few, not one, but like things like Designs for Health Company, or Pure Encapsulations is wonderful. Metagenetics are great. There are more. There are many more. Just I'm naming a few. There are plenty of great brands that you could get quality supplements from. Common mistakes that people make when they're trying to heal on their own. They're trying too many things at once, and they don't know what worked, or they think none of those are working because you try too many at once. Not trying diets long enough, or I get things like, I've tried gluten-free diet, it doesn't work for me. How long have you been on it? About a week or two. That's not enough time to understand, especially if you're mildly intolerant and you're in state of mild chronic inflammation from it. You will definitely not feel the difference taking it out of your diet for a short while. I get people that are doctor hopping, how you call it. You're looking for a magic pill, and unless you put in the energy and effort and you're ready to heal, not much can be happening. So have that practitioner you're planning to work with, find a connection, and give it all to that practitioner. I think it's super important, and give that doctor or practitioner a chance to, and listen and be coachable. Don't argue. That doesn't help the healing process. Also, understanding drug herb interactions. Many practitioners still are not up on that, because a lot of people are now taking herbs, a lot of people are taking vitamins and still taking prescription medications. The doctor doesn't know much about interactions with those. There's not much available out there to check those, to be able to give you a great answer whether they interact. But you need to be really, really careful, and you want to be asking questions. If you're putting something in new, like, and look what you're currently taking, would this interact? If your doctor doesn't know, call your pharmacist. If your pharmacist is not sure, do more investigation. Call the company that you're planning to take that supplement from. They'll do more research for you and will tell you. But don't leave it just like, maybe it will be fine. It's very important that it could potentially cause trouble. Support is important. Part of the challenge to healing. If you don't have enough support, whether it's your spouse or your family or the practitioner you work with. I've had clients that cannot stand their doctor. Like, how do you expect to heal if you cannot stand your doctor? That's just simply, I'm not getting that. Like, change your doctor, then find someone you like. As simple, like, I'm not being harsh. I'm just saying, find someone you truly like. New scientific data is coming all the time. So you do want to find a doctor or practitioner that's on top of things. That's not he's saying, I learned this, I've been experienced for so many years, but you haven't looked into new study for 20 years. It's there's a lot of new stuff coming up. Be on top of stuff. And you could always hire help. That's something I do. I do consulting and coaching. Part of my signature program is really address all these things that I mentioned today. It's not just physical, part of it is emotional healing. It's really important to heal here when you're trying to heal your physical. Balancing hormones also has a lot to do with emotional health. So we address all these aspects as functional medicine addresses. We are a whole. We are parts of our illness originated in physical stress, toxins outside, a relationship with people. Loneliness can get you really ill. So a lot of different aspects, and I work with my clients and we talk about all of these things. I'm going to say goodbye to my wonderful Facebook crowd, and I'm going to finish up the webinar with my wonderful people here. I will, if you have any questions, you could always PM me through Facebook, and I really thank you for watching. I will update you soon, guys. I'll speak to you. Okay, and hi guys, I apologize for this few second delay. All right, so I know you've been wonderful and been patient. I started a few minutes later. I wanted you to just think about how your illness or your symptoms impact your life, and do you have energy? Like, I know that for me it was energy issues. I know that I would have given anything to get my energy back at that point when I was so sick. And my client, like, I did a survey, a lot of chronic gut clients, they're not even willing to give up the diarrhea or constipation or whatever gut stuff they have. They want to get back their energy. It's really huge. So that's what my first book is about. I'm not sure if you guys got a chance to read my Crohn's and Colitis book, Crohn's and Colitis Fix. But just to understand that getting more energy and and changing your quality of life and time for your loved ones. I think it's life-changing, and life-changing since my client from last night said that I changed her life. This program is life-changing. How is that? I developed this program over almost a decade. The reason I developed it was because I originally was sick, and I had the experience as a patient myself. And then my original clients came accidentally. I wasn't looking to open up a practice. I was a working pharmacist at that time. And my original patients came through my original side journey with Crohn's disease. They all asked me to be coached and helped. I was ready and willing because I felt that this was my mission, and I guess it was. And that's how my practice grew. And I've been helping clients ever since. Right now I have a signature program, and it is something that I get amazing results for my clients. I get wonderful feedback, and I love to be doing that. My offer for today is my initial consultation is $299, and that's where I discuss my program with you and whether you're a perfect fit, whether we could work together. And my offer to you is to get it at a half off at $299. I had half of that at the $150. Let me just turn off that thing. Okay. And once we get to initial consultation and I look at your case and I see that we are perfect fit to work together, I will determine which, I will recommend which functional diagnostic tests are proper for you, perfect for you, and I would be able to give you a full cost of the program at that time. So this is my email address, ina@digestivereset.com. Let me know what you decide if you want to take me up on the offer. This is a phone number for my office, 732-414-6223. And you could also get my first book for free at the site digestivereset.com. It's available there for free download. My second book is coming out in April. It will be called A Digestive Reset. It's on balancing gut inflammation and hormones. So the first one is more about chronic severe IBDs. And this one is about chronic gut stuff with hormone imbalances. So I will be getting my Facebook team lunch. And if you are interested, you could also go on there and be the first one to get a free copy of my book before it even goes on Amazon in April. And that will be within a few days already. My editors and publishers, they have it almost ready to be given as advanced reader copy. So you could also let me know if you're interested in that, and I'll put you into that group. And it was really great to spend the time with you. I really appreciate every and single one of you for giving yourself a chance, for spending the time for you learning. Just learning is the big first step in healing and making big decisions. And I'm here for you guys. Just email me if you need me. If you wanna schedule, you could directly go on schedule from digestivereset.com. And once I see a name on and you booked your appointment, I will send you initial client paperwork, and you'll mention that you have been watching the webinar. And this way we could get you at half off price for the initial consultation. So I hope I gave everyone information, and I'm really grateful that you guys are with me. I am going to stop recording.